Hi, today I want to talk to you about German healthcare. After what's been going on with the Affordable Care Act in the US and the NHS in the UK, I felt like it would be interesting to get some perspective from a country that is kind of known for their good health insurance. At least German people like to be proud of it. And while it is fairly good, there are of course some drawbacks, some facts that nobody internationally knows, and I've been thinking about this a lot. I wanted to share it with you. The first thing you need to know is that German healthcare is mandatory. Every German citizen needs to be insured in some way. Of course, there are always some people who just aren't for whatever reason, but that's kind of illegal. We have a two-class system. For one, we have the statutory insurance, or gesetzliche Krankenversicherung, and the private insurance, private Krankenversicherung. The more common one, because it's essentially the basic and also cheaper insurance, is the gesetzliche Krankenversicherung, so the statutory insurance. With the statutory insurance, you can be insured in a number of ways depending on your status or situation. So for example, if you're employed, you can get insured via your job. You have to pay a specific percentage of your income towards health insurance, and your employer pays the same amount. So of course that varies based on your income. I just know that my mom, for example, always had to pay around 200 euros a month from her income for health insurance. Then you can get insured by a family member, so your spouse if you're married, or your parents if you're under 25. You don't have to pay anything extra for that, you're just signed onto your spouse's or parents' account. Then if you're over 25 but you're still a student like me, you have to get your own account, but you get a special reduced student rate. Right now, me for example, I pay 90 euros a month. If you're a pensioner, you get a reduced rate as well, which gets taken out of your pension, and if you're unemployed, it gets taken care of by the state. At least it should do. Now the statutory health insurance pays for pretty much all you need, especially if you're somewhat healthy. It takes care of standard doctor's visits to the GP, or even specialist doctors like dermatologists and ear, nose, throat doctors, whatever. Basic blood work and other tests. Generally also visits to the hospital and surgeries, but when I went to the hospital, I had to pay 10 euros boarding fee each day. And that one time I went in an ambulance, I also had to pay 5 or 10 euros copay. But the whole ambulance drive cost like 300 euros, so just having to pay 5 or 10 euros really isn't all that bad. Prescriptions also require a copay. That's usually 5 euros, sometimes it's 10. For one of my medications, it's 10 euros. For the other one, it's 5. And that's also mostly only for necessary medications. So for example, if the doctor prescribes you a nasal spray or cold medication that's more of a suggestion that you should take, you have to pay that price in full. And the contraceptive pill is also only free, well, apart from that copay, until you're, I think, 21. After that, you have to pay it in full, which depending on the brand and combination, it's around 35 euros. And also, kind of as a side note, over-the-counter medication is really fucking expensive in Germany. For example, painkillers like ibuprofen and paracetamol that I can get for 35p in the UK and maybe 170 or 180 in the Netherlands, they cost upwards of 5 euros, sometimes up to 8 for a very small package as well. The dentist and dental surgery is also covered, but only the basics. So for example, if the doctor suggests local anesthetic but you want to be put under complete anesthetic, you have to pay for that. And if you want to get a filling that's not basically poison and has to get renewed in like 3 years anyway, you have to pay for that extra as well. And if you're under 18, the dentist also covers braces, so you would be really wise to decide to get braces when you're still a teenager, because otherwise it's up to like 3,500, 4,000 euros for a treatment. Yeah. Therapy is also covered, but the approval process is lengthy and horrible, and a lot of people choose to pay it out of their own pocket. Also because the health insurances mandate a certain amount of therapists that are allowed to practice within a certain area, which is way too low, like a tenth of what is actually needed. And there can be other therapists, but they are not approved for being paid by the statutory health insurance, so you have to pay those out of your own pocket if you want to go there. So if you really need therapy, but all the therapists in your area that are approved by, or like for statutory insurance, have a 6-month waiting list, which does happen, then you're either out of luck or you just have to hope that you're really rich or have rich parents. And then there's the private insurance, and thinking about this just always riles me up because, as I mentioned before, it really is a two-class system benefiting the rich. So while the statutory insurance is just based on your status, whether you're employed or a student or unemployed or whatever, the private insurance is more like, I guess, the American one because it's based on your age and your pre-existing conditions. It used to also include gender, but as far as I'm aware, they scrapped that because it's discriminatory. When you're privately insured, you get a lot of benefits like preferential treatment for making appointments or in waiting rooms. So, for example, a friend of mine, if she rings up a doctor and she says, well, hey, I need an appointment, and they're like, well, but we're booked for the next 6 weeks or whatever, but then she'll like, oh, but I'm privately insured, they will have a spot free within the next couple of days. And also in waiting rooms, it happens a lot that the ones that have private insurance are called up a lot sooner than the other ones are, even if they come there without an appointment. Of course, you can't really tell just from sitting in a waiting room. You can't look at a person and say, oh, they're privately insured. But it does happen. If you're in hospital and privately insured, you can request treatment by the head physicians, like the most senior doctor. And you can also request to get a single room rather than a double or even 3 or 4 bedroom with strangers. The thing about private insurance is that it's fucking expensive. It's also based on when you actually sign up for it. So I know that if I signed up right now as a 26-year-old, without even calculating with my pre-existing conditions, but just as a student at 26 years old, I would have to pay at least 200 euros a month. That's twice the amount that I'm paying right now. A friend of mine who has been privately insured for years, however, she is currently paying like 140, and she didn't have any pre-existing conditions back then, so the price does vary. And it also varies based on how much you're willing to sign on for copay for like surgeries or medication or whatever. But even my friends, it's 50 euros more expensive every single month compared to my statutory insurance. And if you're a student, that's an awful lot of money. Plus that's the reduced rate, so if you're not a student anymore, I don't even want to know how much you have to pay. As someone who's chronically ill and who will have to be in and out of doctor's practices and or hospitals for the rest of her life, shit like this makes me so angry. Don't get me wrong, I feel like I'm complaining from a very, very high horse because our healthcare is solid, our doctors are fairly good, even in an international context, so much so that because they're not paid well enough here, a lot of them just travel abroad. I know that there's supposed to be a lot of doctors, like German doctors, in Australia, which is really interesting, but we need to pay them better. But I really feel like our healthcare could enjoy some updates as well. Alright, so because I also just know about the healthcare in Germany and the UK and the US, I would really, really, really like to know if you have experience with any other health insurance concepts in Europe or the rest of the world, because there must be different ones out there that are maybe better, maybe worse, maybe bad in a different way, good in a different way. So this is a topic that's close to heart and I would really like to know more. So please share if you know anything. And I will be back soon to talk more about IBD and all that kind of shit.